So, welcome to the second session, the community sessions that we're organizing with the AIDS Solidarity Movement as part of the PrEP month. Let me just say first that these are, we just launched the PrEP Point, the Cyprus PrEP Point on the 29th of May, which is the Community Information and Empowerment Center for people who decide to take PrEP under their own responsibility, as PrEP is not yet available in Cyprus. And we have this series of sessions. Too much noise here. So we have this series of sessions. So we disseminate more information with guest speakers and PrEP experts. These recordings are going to go online on the YouTube channel of the AIDS Solidarity Movement later on with the subtitles in Greek. And let me just say that let's keep our cameras and microphones closed while Yannis Mameletsis is presenting, and then we can have the chance to discuss after I stop the recording at the end of the presentation. You can keep your cameras and microphones switched off if you wish to and use the chat, or turn on your cameras and microphones at the end of the session so we have a discussion. I'll also put on the chat the launch video that is already online from the 29th of May, which is subtitled in Greek and English as well, and the PrEP month schedule and registration links in the chat so you can also register. Yanni Mameletsi, welcome. Thank you for accepting this invitation. I have to tell people that are watching this, that are attending today or are watching this video at a later state, that you were one of the key people who supported us back in 2019 when we first ran the survey on PrEP in Cyprus, just to demonstrate that we had, we do have, and we have been having PrEP in Cyprus unofficially, and this was documented through that survey. And back in 2019, you came to Cyprus and you presented together with other experts the cases of why PrEP should be implemented in Cyprus. And I also have to add that in the last year, when we had these efforts in the National AIDS Committee to prepare the plan, the proposed plan from the National AIDS Committee for the ministry, I requested that you had, that you sent us a letter of recommendations of best practices, and you did so, and you really helped us with that, and thank you very much. So welcome, and the stage and the microphone is yours.
Thank you very much, Christos. I hope you guys can hear me. Very much delighted to be joining you, and I sort of want to first congratulate you, Christos, Zoe, and your colleagues at AIDS Solidarity Movement for all the years and energy and input and persistence in your advocacy work on PrEP, in HIV prevention and testing and treatment in Cyprus. And I think it's better late than never. I know it's been since 2019 when I had come to Cyprus for that PrEP consultation, where I was kindly invited by you. We had a pandemic. There's a number of conflicts, wars in our region, but nonetheless, we are where we are today, and hopefully we'll be able to move from informal PrEP, as you indicated, PrEP in the wild, as somehow it's noted in the literature, to formal PrEP access for people living in Cyprus. And I think this will be an important public health achievement. So thank you. This is the second talk in the webinar series for PrEP month. It's great to have a PrEP month. And my understanding is Professor Nikolopoulos gave you a baseline overview of PrEP, so PrEP 101. This talk today is a bit of PrEP 102. I'll talk about access and service delivery approaches to PrEP, and also provide information on the different PrEP products out there and how to use oral PrEP, which is the product that will be formally accessible in Cyprus in the foreseeable future. So my talk is entitled PrEP in Times of Uncertainty, because we are living in times of uncertainty, wars, pandemics, and Trump. So first, I think whatever you take away from this talk, and some things may be new to you. Some of you on the call may have not had sort of much exposure to PrEP. Nonetheless, let's use this webinar as an educational opportunity. Overall, I want you to come away with understanding that oral PrEP will have individual benefits, but also benefits to the public health of the country. So those are two very much positive aspects of PrEP implementation, introduction implementation in the country. We know from global experience for over a decade now that PrEP is very easy to provide, to deliver across settings and even in non-clinical settings. And we have done this through the COVID-19 pandemic, and we're doing this in the context of war. And I will give you a little bit more sort of perspective from my work as a WHO PrEP advisor in Ukraine since the full-scale invasion of the country by the Russian Federation in 2022. And also, really critical point for all of you on this webinar, for our decision makers sitting in ministries of health, but also for the medical community, for physicians, for nurses, for pharmacists. Everybody collectively needs to understand that communities, civil society needs to be at the forefront of designing PrEP programs, and also in having the ability to deliver PrEP. And I'll get into that a little bit more. And of course, Cyprus will be implementing oral PrEP, but there are other products in the future, and we'll talk about long-acting injectable PrEP products, which are becoming available in other countries. And hopefully this can become a reality in Cyprus. And lastly, I think all of you understand what's sort of the global health context. The Americans, the US government under Donald Trump has ceased funding in the global HIV response. And there are, of course, this is a very negative development. And so, yeah, if for any of the sort of those of faith, please pray that maybe he has a change of mind. First, I always use any PrEP talk to just mention that we should be also talking about post-exposure prophylaxis. In the early days when PrEP was being rolled out in countries, in France, for example, it was the first country in Europe to have an official PrEP national program. There was still confusion between PEP and PrEP, even from the healthcare worker community. PEP, of course, is the use of anti-HIV medicines, antiretrovirals, after a risk exposure, whether that is through sexual exposure or needle stick injury. But here we're dedicating our talk to PrEP, pre-exposure prophylaxis, so it's the use of an antiretroviral drugs, products containing antiretroviral drugs before and after a sexual exposure. There's different products. It's not just the tablets, the pills. In Cyprus, as in the rest of the European region, tenofovir in combination with emtricitabine. This can also be in combination with another drug called lamivudine, that's 3TC, is the drug that we're talking about. However, WHO in recent years has also recommended a silicone vaginal ring that contains an antiretroviral called dapivirine. And there's also injectable, there's injectable PrEP. So that WHO has recommended a drug called cabotegravir. And soon to be, WHO this summer will be recommending a 6-month injectable shot called lenacapavir. And so that's very exciting. But in Cyprus, Some of you may be using PrEP, may have used PrEP in the past. The branded product Truvada, here in this photo on the right, is what Gilead Sciences has produced, and often that's kind of the PrEP is synonymous in many places with Truvada. However, generic PrEP, which you may be sourcing online or traveling to another European country where there's formal PrEP access, even through pharmacies with a prescription. Then there's different generic products, and here's an example of Mylan and Simpla. These are Indian manufacturers, quality assured product. It works just as well as Truvada. I mentioned in in the previous two slides about cabotegravir. This is a 2-month injectable. So this is something that is being rolled out in a few countries. This is an advert from the United States. The trade name of cabotegravir in the U.S. is called Apretude. It's a 2-month injectable. It's highly effective, as effective as oral PrEP. And this is just in terms of demand creation. The the text on this slide is PrEP without pills, and so yeah, there's still limited uptake in the United States. It's in a more expensive product. The U.S. has its own sort of health systems challenges. We're trying to implement this in sub-Saharan Africa, in some Asia Pacific countries. We've also been implementing this in Ukraine, but often cabotegravir access is based on U.S. government donor funding, and this has stopped, has been paused, in fact, as of the first quarter of this year. Now, an important aspect of using PrEP or being on PrEP or taking PrEP is that it often is pitted against condom use. And I think it's really important to understand that there will be people that don't use condoms, don't like using condoms, cannot negotiate condom use, and therefore PrEP is a very important option for them to prevent HIV acquisition. However, there are also many people that will be using PrEP and condoms with different partners. And so this is all about individual choice. And again, it's important to underscore that condom use is important in preventing also not just HIV, but other STIs, and of course, preventing unwanted pregnancies. Something that I use this slide to when speaking to policymakers, politicians who don't know about PrEP, just trying to highlight the point that somebody who's on PrEP, and in this schematic, it's that person in the middle who's in green, when in a sexual network, when they are having, I apologize, the person in the green is somebody who has HIV, is not diagnosed with HIV, and therefore is not virally suppressed. So that person is in that sexual network with people on PrEP. Those are the people in the pink. So those people, when they're on PrEP, they will not acquire HIV. They will not get HIV from that person who is undiagnosed and not virally suppressed. The secondary point, which is very important for population health, public health, is that people not on PrEP, who are having sex with people on PrEP, are also protected from acquiring HIV. So there's individual benefits to somebody who's on PrEP, of course, who will not acquire HIV. But this is also, it reduces the overall population level HIV risk in that sexual network. So the take home message here is that people using PrEP, people who've used PrEP in Cyprus, people who will use PrEP in Cyprus, are making a responsible choice for their own health, but also for the health of their wider community. We've seen this across countries and regions, the population level impact. When you get enough people on PrEP in a geographic region, you start seeing population level HIV go down. And this is an example from Australia. Um, Something we were talking with the friends at AIDS Solidarity Movement was that in the coming months, as the PrEP national plan and the implementation plan is finalized, and when we start seeing certain health facilities to be able to prescribe PrEP, it's really important for the community to have access to basic information on where they can get PrEP. This is an example from London, from the UK, when they started having PrEP being available in the National Health Service in that country. So again, this information should be also designed with the community in mind, and often materials should also be in more than one language, especially because we always advocate for PrEP to be accessible to not only to native speakers in any country. On that point, it's also important for governments to understand and for everybody to understand that people who move, migrants, refugees, often are at disproportionate risk for acquiring HIV, and PrEP access should be prioritized also for migrants and refugees in any country. It often is not the case, but it should be. PrEP is not simply about taking pills. Yes, it's very easy to deliver. Yes, it's very easy to take, but I think we also need to appreciate the fact that PrEP is about PrEP care. So it's a package of services that we provide when people are seeking PrEP and are taking PrEP. The most important thing is to rule out HIV infection, and so HIV testing is in place. Whether you're taking PrEP informally or you will be taking PrEP through some formal access entry point, it's the most important test is to do an HIV test and rule out HIV infection, that you're HIV negative. If you test positive for HIV, then of course you should be linked immediately into treatment and care for antiretroviral treatment. PrEP is also an opportunity to test for the other STIs. HIV is an STI, and so depending in Cyprus what your technical working group and the Ministry of Health decide what will be part of that STI testing package, it's also a great opportunity to vaccinate for things such as hepatitis A, hepatitis B, Mpox. Apologize, I have like the old terminology here for Mpox. Condoms, lubricant should be always available at any place where PrEP is delivered. And the phenomenon of chemsex, particularly for men who have sex with men, is something that needs to be considered in the PrEP care package. And therefore, your healthcare providers in Cyprus, working with community, should ensure that they're providing tailored chemsex interventions for people that may be engaged in chemsex. Also, PrEP is a wonderful way into entry point for mental health services, which are often not prioritized in health systems, and reproductive and sexual health services. This is just an example from South Africa, where, again, this is a PrEP user. He's very open about his PrEP use and talks about how taking PrEP is like taking his multivitamins. And this is actually an important thing. I know it may be very difficult in settings like Cyprus, in some places where there is sort of norms can be a bit more traditional, but we should be trying to celebrate and encourage people who are using PrEP to be open about their PrEP use, particularly within their community, in order to generate demand and get people to come in for services. So PrEP, of course, can if we get enough people in Cyprus on PrEP and we expand HIV testing and we diagnose everybody with undiagnosed HIV and put them on ART, this is how we will end HIV in Cyprus. And it has other benefits beyond the population health benefits that I've been describing. In particular, I think I point to to the issue of reducing fear and anxiety during sex, and also enhancing pleasure and reducing HIV stigma for the individual, but also within a community. And these are key elements, they're public health elements. And WHO's definition of sexual health includes the word pleasure. And this is an important public health um, indicator and objective for any sexual health programming. Again, this is often ignored in settings of traditional norms where we may not have very good sexual health education in schools, and there may be, again, stigma associated with sexual health in the health establishment, the medical establishment, but this is something that should be working towards. And of course, PrEP is a very key element of having agency and feeling empowered for the individual. Um, we've known for a long time through implementation research and evidence from that implementation research, from programmatic data from HIV national programs, that PrEP is very much very easy to deliver and should be easily delivered. And how is that done? That's done through and demedicalizing PrEP. You do not need a medical doctor to spend an hour of their time counseling somebody about what PrEP is, the side effects of oral PrEP, how to start PrEP, how to stop PrEP safely. This engagement and work can be easily done by non-clinicians, by nurses, and also people that are trained from the community healthcare workers, peers. The challenge in the European area, in the region, is that we've been medicalizing PrEP initiation and delivery for over a decade now. In some countries, there's a bit of a shift in this, but nonetheless, we still, in my viewpoint, and I think in many experts' viewpoint, that we're still over medicalizing PrEP delivery in Europe. This is a map sent from my dear colleague Timur Nouri at the ECDC in Stockholm. It just shows you PrEP implementation access so far in Europe. It's actually from the end of 2023. This is being updated. Green shows you that PrEP is there's a policy. That means there's national PrEP guidelines in place in that country, and that the government is offering PrEP in under a national program. So whether it's partial or full reimbursement. In Ukraine, for example, where I've worked for the past few years, there's been a national program actually since 2019. Again, that was very much based on external donor funding, but we've had free PrEP in Ukraine since 2019. It initially started as a pilot. Greece is circled in red there because they're soon to be there. They have guidelines in place. They've actually started delivering PrEP a few weeks ago in a few health facilities. And Cyprus hopefully will be updated because you have no guidelines officially published, but this is something that the country is working on. Important for, again, people on this webinar, people who may listen to this webinar afterwards, PrEP guidelines are, of course, are a technical document, but that does not mean that it should not be up for a public consultation. This is done in many countries. It's done, for example, we do it in Ukraine. This is also done in the UK with the British HIV Association guidelines. So I would encourage, again, policy makers, those working on PrEP in Cyprus, to ensure that their guidelines also go for a public consultation. Again, that's also a process of educating the community and ensuring the community feels that they actually have a meaningful stake in how PrEP is being, a PrEP program is being developed and it's being implemented in the country. Now, back to the title, Wars, Pandemics, and Donald Trump. I'm just trying to give you here a sense of how PrEP, in terms of being something that can be easily delivered and demedicalized, the pandemic really forced us to actually do this. And so in Thailand, this is a schematic of how they actually use members from the community, from community-based organizations who are not clinicians, but they're trained and they're certified by the Ministry of Health of Thailand to be able to do most of the procedures from counseling to phlebotomy, drawing blood, and being able to engage with somebody who wants PrEP, a PrEP client, if you will. The the medical oversight happens remotely from a medical doctor, a physician. And so this is when we say demedicalize, that does not mean removing the physician totally out of the patient, the client pathway, the client PrEP pathway. And again, I would encourage that something similar can be also implemented in Cyprus. We have great examples from sub-Saharan Africa. We did this in Ukraine during the pandemic as well, and we are trying to do this through the current context of the war, and many other places where this is a client pathway. I'm not going to get into this too much because I'm conscious of the time, but I think some key points for those who are interested in starting PrEP, or maybe they're taking PrEP already. Some key messages: PrEP is incredibly effective, both oral and the other products. It's over 99% effective when used appropriately, taken as prescribed, as we say. It's very safe. Oral PrEP, as with any other drug, does have certain side effects, and this is why it's important to counsel the individual on some of these side effects. There are very few interactions between oral PrEP and other medicines. Anti-inflammatory drugs are one particular medicine that comes to mind, and that should be disclosed when somebody is starting PrEP or comes back for their follow-up appointments. As I said, you just need, at a minimum, you need to rule out HIV infection. You need to make sure the person is HIV negative, and therefore they need to do an HIV test. PrEP use is not simply about preventing HIV, but it's about overall sexual health and sexual wellness. It's a responsible choice. I use that sort of repeatedly because often PrEP users can be stigmatized and can be targeted as being irresponsible in their use of using PrEP, because it implies that they're not using condoms, and when you're not using condoms, that is, again, there's a judgment that is placed on an individual, and it should not be. Again, people use PrEP for different reasons at different times in their lives, and having PrEP access, formal PrEP access, and this is why this is also very important in Cyprus. It's an opportunity to also test for the other STIs, and an important opportunity to treat appropriately for those other STIs, so part of that package. Again, I know we talk about teleprep, telemedicine. We live in the era of Zoom, like right now we're doing this webinar. But people want to have an opportunity in a very non-judgmental way to be able to speak to somebody about their motivation, the reason on why they're using PrEP. Some people may not be as forthcoming to do so, and so it's really important to build the art of communication with PrEP clients. And I think this is something that already you've been doing at AIDS Solidarity Movement. You have actually the Cyprus PrEP Point, which is officially launched, which is an incredible milestone. And we look forward to, again, expanding PrEP access in the country. Women who are pregnant or breastfeeding can safely use PrEP. PrEP is not only for men who have sex with men, it's also for other populations. I know in some of our European countries, the focus is on PrEP in MSM, but we of course need to ensure that the program is inclusive of other populations. Again, reinforcing that PrEP for cisgender women is highly effective. We also need to think about female sex workers in any setting who may be at much higher risk for acquiring HIV by nature of their work. And so the spaces and places where sex workers, female sex workers, are getting their care. Again, we need to be educating those providers, those places, and providing PrEP information there. And it may not be the places where the gay bisexual MSM go to. So that's really important. The other thing is to note that in other countries there is the Depivarine ring and the long-acting injectable products that are incredibly effective in preventing HIV in cisgender women, and something that I think women's health advocacy groups in Cyprus should really consider on how the Cypriot government can look for access to those products in the future. One thing in terms of oral PrEP for cisgender women, the recommendations from WHO are in order to reach maximum levels of protection against HIV, a woman has to take a pill every single day for up to 7 days. And then you reach levels, the highest protective levels in the female genital tract. And then once you stop, when you consider that your risk period is over, then you would take a pill every day for 7 days out, for a week after the last exposure risk. Transgender people, transgender men, transgender women are so often, most often neglected in PrEP programs. And I don't know how many what is sort of the estimate of transgender people in Cyprus. But there are people, they may not be as visible in Cyprus as maybe other countries. Maybe they are, pardon my ignorance, but our PrEP programming, and of course, from the perspective of a community, we need to make sure that we are inclusive of these populations, and that the material, PrEP education material, is really is targeted for them. An important point is that for transgender women, providing PrEP is also a great sort of opportunity to integrate feminizing hormone therapy. And one thing we know is that the interference between sex hormones and PrEP has not been observed. So PrEP for men who have sex with men, I think probably the group that will most likely benefit, the largest group of people that will be getting formal PrEP access in Cyprus. The PrEP programs in Europe, North America, Asia Pacific, Australia, those are largely the people that are using PrEP are men who have sex with men. The majority of cisgender women who are on PrEP by proportion are in Eastern Southern Africa. I talked about chemsex as a phenomenon that's been part of the MSM communities everywhere in the world, and this is something that should be appropriately addressed in Cyprus. And I think it's really important for the PrEP program in Cyprus to ensure that you actually prioritize people engaged in chemsex. If somebody's engaged in chemsex and they're not on PrEP, they likely or probably should be on PrEP for sure. And I talked about PrEP is also a great opportunity to think about vaccination, including HPV vaccination to prevent anal cancer. I'll just pause here. Christos, do I have a little bit more time? Can I just, I'm wrapping up soon.
Yes, yes,
okay?
yes. Go ahead.
And so again, these are a bunch of indications why someone would need PrEP or ask for PrEP. This is, I'll take a look, hopefully, maybe at your guidelines. But in the way these are indicators, risk factors for why somebody would be using PrEP. And of course, it's, if you're not using a condom consistently, it's a good idea to probably have a PrEP bottle, a PrEP prescription, and be using PrEP. And these are all the other indicators as well, as I sort of noted. Some other considerations related to PrEP use, of course, it can be taken with or without food. And one of the challenges, as with anything, and this is for oral prep, is that you have to be taking you should be taking your pill on time. And I'll show you in the next few slides about the two ways of taking oral prep. The benefit of a long-acting product like cabotegravir, which is every 2 months, or lenacapavir, which is every 6 months, is that you don't have to take a pill. You actually have a drug in you that reaches levels of protection, and so this is one of the reasons why many people are in places where cabotegravir is available, are choosing cabotegravir as opposed to taking pills. But it's really much an individual choice. On taking oral prep, this is the dosing approach for anybody, irrespective if they're a cisgender man, cisgender female, transgender man, transgender woman, and non-binary. This is the recommendation. So your period of risk, however, that could be like a few days, a few weeks, months, years, where you'd be using PrEP. That's the green. But the loading dose is taking a pill every day for a week, and then when you have your last sexual exposure, you'd be taking a pill every day for 7 consecutive days. And then you can go off and use whatever methods to prevent HIV, whether that's using condoms consistently, reducing your sexual partners, or just like not having any sex. But the on-demand approach, or event-driven PrEP, is something for cisgender males. It's something that is very popular as well. It's for people who may not be having a have a sexual exposure that often. It's people, for example, that may be having sex on the weekends. And this is where you take a double dose 2 to 24 hours before your sexual encounter, and then you take a single tablet 24 hours after that initial double dose, and then you take another single pill 48 hours after that double dose. So this is very popular amongst gay, bisexual, and other men who have sex with men in many other countries. And again, PrEP is easy to deliver. PrEP should be easy to deliver. And we have lots of implementation evidence from many countries, including South Africa. This is an article from South Africa, where they have the largest PrEP market, the largest PrEP use, and that's because they're also the place with most people living with HIV who are on HIV treatment. A wonderful example of community-led, community-informed PrEP programs and projects is from India. So India, like other countries, has concentrated HIV in specific populations, in men who have sex with men, and also sex workers. And this is wonderful work where sex workers in the cities of Mysore and Calcutta were actually the ones that came up with the design of the PrEP program, the design of how PrEP would be, how sex workers would be counseled on PrEP, and how they would use PrEP. And they saw very high levels of adherence, very high levels of protection against HIV, and a very successful model. And this is published in the literature. And again, this is the kind of work that, yes, India is another continent. However, there's important lessons that can be learned from other pilots and programs in other countries, again, specific to certain key populations. An example of PrEP demand creation and for transgender people in Thailand. And here I point to USAID, PEPFAR. These are American donors who've invested prior to Donald Trump becoming president, very much invested in HIV programs and HIV PrEP programs in other countries. And very sadly, over the past few months, or since the beginning of the year, the U.S. administration has been cutting funds to these programs, and also impacting HIV-related research. So not just actual PrEP programs in countries, but really killing HIV science. And so there's a lot of uncertainty, speaks to the title of my presentation, and we don't really know where things will stand in the forthcoming future as far as HIV programs. Ukraine also very much benefited from U.S. investment in its PrEP program. This is an example of a beautiful portal website for the community. It was designed by community for community. So it's not, a very dry, boring website for simply for clinicians. And it had all the relevant information. As you all know, since 2022, the country has been under full-scale invasion by the Russian Federation. This is an HIV clinic, ART center, AIDS center that provided also PrEP in the region. This is what people have to live through. The red is like the whole country is on air alert. Then it changes to specific regions. This was my reality, or has been my reality when I've been in Ukraine. Nonetheless, services continue. This is a fantastic initiative on harm reduction and chemsex services and PrEP awareness and dissemination and linkage to PrEP services that's being undertaken in Kiev and other parts of the country. Just quickly, in Ukraine, we also have a very mature monitoring evaluation system of capturing data on PrEP use. Since PrEP was rolled out as a national program in 2016, as I said, sorry, 2019, we've had over 12,000 people initiated on PrEP. This is just data on an indicator called PrEP New. These are new PrEP initiations by quarter from 2023. And we also disaggregate data by population, key population. And we also do that by oblast, by region. And you can probably see there in Dnipro and Kiev have like the highest sort of volume of new PrEP initiations. So despite the war, PrEP, successively every summer we've been getting more people on PrEP. This is like the government's PrEP portal. Something that I sort of going back to what I said, we need to have people that talk about their PrEP use, or I know with HIV testing, we often will get celebrities to do an HIV test. This was a wonderful example from Prince Harry many years ago when he did a live HIV test, and then they saw an uptake of HIV testing over the next few days. I think it's really important that we have, in any place where PrEP becomes available, visibility, put a face to a PrEP user. This often is not very comfortable for people, but it's something that within communities we should really try to do that type of having those PrEP champions. Lastly, I conclude my presentation by just mentioning lenacapavir, that 6-month injectable PrEP PrEP product. We are in the era where many people are using injectable products for obesity. We've so many people, obviously, like the globe has sort of had to deal with the pandemic and vaccination campaigns. And so I think we are in the era of long-acting injectables, or soon to be long-acting injectables for PrEP. This product, lenacapavir, in the next few days, this week, will most likely get FDA approval for licensing in the United States. And so from an advocacy standpoint, I think it's also really important for those in this room, for the AIDS solidarity movement, and sort of more broadly, people engaged in HIV advocacy in Cyprus, to actually think about how this can become accessible in Cyprus. And yeah, thank you very much for your attention. And I think we are in the month of PrEP, right? In Cyprus, and it's Pride Month globally, and we should really leverage this particular month for spreading the gospel of PrEP. So thank you very much for your attention.
Dr. Mohamed Aziz, thank you very much. Yannis, I have two things before I stop the recording and we have the open discussion. The first one is that I realized that it would be very useful to have some more information a bit about your background. I introduced you and through the announcements as a PrEP consultant. We met you back in 2018 when you were working for WHO. I know you've been involved with a program in Ukraine. You've also been involved, from what I understand, with the efforts in Greece and also in Cyprus through us. So the first thing is that I think it would be very interesting to give us a few information about your work around PrEP, which is so rich and important, and thank you for it. The second thing is a quick question about what happens if somebody is taking PrEP in less than 2 hours before sex.
So that's a great question. I'll answer the first question. So usually in real practice, you say take it even up to an hour before sex. People often take it even just a few minutes before sex. So that's so that also means this is for the on-demand approach. So it's if somebody, real life is not perfect, right? So you advise people to take PrEP 2 to 24 hours before. Often we encourage people to take it maybe closer to the 24 hours than the 2 hours, because like the levels of drug, tenofovir in particular, reaches high levels in the genital tissue. It takes a little bit of time to be absorbed, but actually not much. Hence why the on-demand regimen is so effective for gay, bisexual, and other men of sexual men. For cisgender women, we don't recommend it because the evidence we have thus far says that it takes a little more time, hence like a consecutive pill, for the drugs to reach levels of protection in the female genital tract. And so, because it's, the pharmacology differs by gender. So you would advise, if I were to do it, yes, I would take my double dose an hour before I would have condomless sex, and then I would ensure that I would make sure I'm taking my follow-up dose, which would be, as I said, the single tablets 24 hours and 48 hours after. Could there be a risk that is created when you take it maybe an hour versus 2 hours? In theory, yes, but we don't have data that suggests as such. And I think that the on-demand dosing is a very, I would say, robust dosing regimen. I would be, however, if people end up having a sexual exposure without having taken their PrEP and not having taken at all, not having any drug levels in them, then they would probably be a good candidate for PEP, for post-exposure prophylaxis. And this is another thing. It's important as we set up PrEP programs in any country, again in Cyprus. WhatsApp is a powerful vehicle for counseling, for having these PrEP navigators or people who are well trained to answer these exact questions that you asked me. Because people may not be able to find that, or in panic may not be able to access this information in their PrEP 101 leaflet or your beautiful website that you will have. I think that this is why you need on-demand PrEP navigators and counselors. PrEP counselors are really critical. In the early days, even of PrEP in Geneva, Switzerland, where I live, I did this for many friends who I would, like, my WhatsApp and Viber would ring with questions like this. Going back to your question, what my background is, I'm a public health epidemiologist. I'm trained in infectious diseases, specifically in HIV. I have a PhD in infectious diseases of HIV. I've worked on PrEP and saying working on PrEP for over a decade now, since like 2014 and 15. Um, at WHO, we came up with guidelines, evidence-based guidelines informed from big clinical trials all over the world in different populations. And in 2015, we said we made a big recommendation. And then what I've been doing is just trying to help countries take that WHO recommendation and adapt it to their setting. So it's not just about having a guideline, it's a document that tells you about who PrEP is for, how it should be prescribed. It's about having actual programs. So and meaningful access. And so I've been working in Latin America, Sub-Saharan Africa, quite a lot with Asia Pacific. But over the past 3 years, I've been the PrEP advisor for WHO, dedicated to the Ukrainian work. Um, for Greece, I've sort of, along with other colleagues, people, experts working in HIV in Greece, I've been part of a series of technical working groups on developing a PrEP implementation plan. In fact, since 2019, if I recall, yes, when we finished our first plan. And now it's like 2025. I can get sort of sometimes frustrated with like the slow progress, but I applaud like, you know, everybody in Greece who's made this a reality, including within decision makers in the Ministry of Health as well. Even though as I said, I can have a bit of short patience on that. So it's better late than never. I think my encouragement is, as people in Cyprus, of course, there's like really strong linkage with like Athens, Thessaloniki checkpoints, who are doing wonderful work and have been doing wonderful work, and they have been engaged in on PrEP. I'm always an advocate that PrEP should be available also at the checkpoints, not just going to a hospital and getting a prescription. But there's different ways of sort of in a phased implementation effort to, often we start at like the hospital, and then once you're started, when your minister of health and the clinicians will see, okay, this is not rocket science, it's really easy. Then we can task shift and we can decentralize PrEP and we can demedicalize PrEP. But I do argue for community-based, community-led PrEP to be something in the earlier phase of implementation. So even as maybe PrEP is available in your main HIV unit in Cyprus, you will be identifying people who do not want to go to the HIV clinic, who do not want to go to a hospital, because Cyprus is also small. Maybe somebody has an aunt or an uncle who's like a nurse, physician working in that hospital. This is the reality everywhere. And this is why we have community-based centers, drop-in centers, where we're not just doing HIV testing, but we're also initiating people safely on PrEP. And those client pathways can vary a little bit, based on where you're getting PrEP. Yeah, so I think there's just like really overwhelming evidence for oral PrEP that it can be safely demedicalized, um, and and I think that's really important for getting people on PrEP. And to that, there's no such thing as people on PrEP. People have PrEP. People are using PrEP, and people may just have really access to have a prescription and a bottle that they really haven't used, may just want to use at some point in the coming weeks or months. But for me, I think we mentioned this earlier, Christos, it's about that having really good quality PrEP counseling and communication. So all of you, from physicians to nurses, community healthcare workers, advocates, if you are engaged in any pop-up HIV testing effort, that any place where an HIV test is available and is being conducted, that's a place where you should be providing very, very clear information on PrEP, how to start, how to stop. This is called effective use in WHO language, and also where to get PrEP if you can't get it at the pop-up site in somewhere in Larnaca. So yeah, those are just kind of some reflections from my end, but I cannot underscore the point of community inclusive, community led PrEP services. Um, Something often some medical people from the medical establishment do not like to hear. But the reality is, um, we are talking about making services attractive to end users. And me as I also as a policy maker and public health guy, my objective is also just to make sure more people are using PrEP at any point that they need to. And we can only do that if we demedicalize PrEP. Thank you.
Thank you so much. So let me just stop the recording.